Hi YouTubers, Felix here again. It's a while since I've done a video, so I thought, as promised, that I would do a short video regarding my lower surgery. I had my lower surgery in September 2010, September the 13th as it happens, and it was a long procedure which took 10.5 hours. It was carried out by the UK team, St Peter's Andrology, and that was Mr Christopher and Mr Ralph. Mr Christopher did most of my procedures, although Mr Ralph has contributed with a few procedures in the last year or so, which I'll talk about later. I had my phalloplasty and lower surgery done in 4 stages. I do believe now the UK team do the procedure in 3. There are different ways of doing this. Skin can be taken from the forearm, it can be taken from the side, it can be taken from the abdomen, or it can be taken from the thigh. Now when they do this, they take a full thickness graft and they take an artery for blood supply. I chose to have the radial forearm phalloplasty, which at the time was the flagship, if you like, in phalloplasty construction, as it's one of the most sensate parts of the body, which obviously is better, for sexual pleasure, etc. So to do this procedure, what they do is they take a graft from the forearm and a radial artery, and which for the blood supply, and they mould this into the shape of the penis, and they graft it onto your pubic area. That was stage 1. During stage 1 also I had a total hysterectomy, removal of my womb, ovaries, fallopian tubes, and they did half of my vaginectomy. Now when they do the vaginectomy, the UK team do not remove the whole vagina, as I'm aware. They remove the mucosal lining and they fuse it together, which reduces the risk of massive blood loss, which obviously is less risky and more beneficial to both them and the patient. Also during stage 1 they hook up the clitoral nerves down the shaft of the penis. The more of these nerves that you have to hook up, the better the sensation and the overall outcome. Again, for intercourse and sexual pleasure and orgasm, this is beneficial. I've had no problems with that. The hookup worked great and I can achieve full orgasm, both in full intercourse and obviously if I jack off. So yeah, success on that one. Stage 2, just going back to stage 1, that operation took 10.5 hours. Stage 2 I had 3 months later, and that was the removal of the rest of the mucosal lining in the vagina. They fused it together and they sealed everything up, and they embedded my clitoris at the base of the penis, so couldn't see the little fella anymore, which I preferred. Some guys don't prefer that. They prefer to have it outside to give maximum sensation. This can be changed later if you decide that it wasn't really for you. Then stage 3 was about another 3 months later, and in that stage I had the glands sculpted, which they do this by removing a small graft from the side, and they shape this into the head of the penis, which the total overall look is that of a circumcised male penis. In stage 3 also, I had my testicle implant, and I had the reservoir put in my abdomen for the later insertion of the pump for the erectile device. No, sorry, I'll just go back a bit on that. At the same time as the reservoir was put in, the pump for the erectile device was put in one side of my scrotum. Stage 4 was the insertion of the erectile device, again 3 months later. So this in total was September 2010, December 2010 stage 2, March 2011 stage 3, and July 2011 stage 4. So quite quickly, as I had no real complications, such as the grafts which they remove from the creases in your buttocks to replace on your arm. They take full thickness grafts from both sides of your bum cheeks, in the creases, which means that you don't see the scarring much later on after everything heals, and they replace that onto the arm, to replace the full thickness graft that they use to construct the fallow. Stage 4 was the insertion of the erectile device. Now I had, sorry for moving about, I had the Titan Coloplast implant, and they only inserted one rod. You can have 2 rods, to create the erection when you pump it up. That went well, and I have used the erectile device. Obviously I've used it, I've had intercourse with it, and it works very well. So that's about it really. I know some guys go for metoidoplasty, which is the other option, where they release the clitoral head, and so that it hangs down further and looks more like a normal penis, although a lot smaller. But you, as far as I'm aware, you maintain sensation, and later on, if you want, you can have the little fella built up and constructed into a larger penis, and you can actually go forward to have phalloplasty if you find that metoidoplasty isn't what you're really happy with. I don't know how this affects funding. Some people I've had this done around the country, I know, and I don't think that there was a real issues with funding. So they're your options: phalloplasty or metoidoplasty, and it is a very personal choice. People have them for different reasons, go for the different options for different reasons, and that is totally personal. Totally personal choice. For me, I made the right choice. Phalloplasty was totally the right choice. I'm very happy with it, and I would recommend the UK team to any guys. They're amazing, they're very professional, and they'll offer you the best care they can. So if there's any more questions you'd like on phalloplasty and I can help you, then by all means PM me or ask me below the video. Not a problem. Okay, see you later guys. Bye.